The Ship of Shame.
Everything's kind of right for cross-infection.
Tonight on 60 Minutes, the Ruby Princess debacle.
They just let us off the boat.
We were all expecting to be tested.
Negligence, isn't it?
How a colossal stuff-up
Your dad gets off the ship on Thursday.
Passed away the following Monday.
has supercharged the virus.
There's 8,500 people on those cruise ships, and it is a potential catastrophe.
Plus, DIY protection.
The virus is in the hospital.
Why doctors and nurses
I've purchased hooded gowns, airtight goggles.
are rushing to Bunnings.
Frontline staff feel too intimidated to speak up.
And
We have a crisis in New York.
an American horror story.
The idea that we might lose as many as 2 million people is just inconceivable.
Good evening and welcome to a special live edition of the program. Back in the good old days, just a few weeks ago, cruise ships full of happy passengers steaming in and out of Australian ports were a common and welcome sight. Now, in quite unbelievable scenes, maritime and police authorities around the country are forcing the vessels back to their home bases overseas. Of course, it's because of the coronavirus and its ability to spread death and misery so rapidly, especially in confined spaces. Many cruise liners have had confirmed cases of COVID-19 on board, but one stands out as a ship of shame, the Ruby Princess. This afternoon, the New South Wales Police Commissioner called in homicide detectives to investigate what went on aboard the vessel and why there have now been 11 deaths. Here's Liam Bartlett.
Cruise ships used to be considered fun. But in the course of the last month, an invisible and deadly passenger on board, coronavirus, has turned many of them into vessels wanted by no one.
They need to leave and go to their own countries.
It's not fair on us.
Our governments won't let them dock because they fear a deluge of sick people.
It's a big problem for Australia because we don't want to be seen as a place that cruise ships around the world can come to. We've got to make sure we solve the problem, get the cruise ships away.
Our health experts warn of catastrophe if we let them in.
So do we say, all right, we'll take you all on and we'll totally collapse and we'll become an Italy or a Spain? Do the Australian people really want that?
What the cruise ships want to protect is international staff stuck on board, some sick with coronavirus.
It is time to go to your port of origin.
How this debacle on the high seas got so out of control is an extraordinary tale that's left a growing casualty list of victims and devastated families. Are you suggesting there's been some sort of cover-up here?
Yes, I do suspect that.
I'm so lethargic, pain in the eye, like somebody's poking me in the eye. The coughing fits, the sore lungs. I've had days where my skin feels like it's sunburnt. I can't touch it. My head is so sore, it's like somebody's pulled my hair.
Hidden in the suburbs, stuck inside and dreadfully sick with COVID-19, Gary Callahan has had plenty of time to get angry. His wife Kerry's meticulous cleaning and obsession with keeping her distance is working. So far, she's virus-free. The Callahans were some of the now infamous 2,700 passengers who 2.5 weeks ago were hurried off the Ruby Princess cruise ship, unbelievably, without being tested by health officials. Everybody on that ship was allowed to disembark without any test whatsoever.
Yes.
Yep.
Do you find that staggering?
Now, yes.
It's crazy. Well, I thought we would have been given a mask, some plastic gloves, go through the quarantine checking, get your temperature checked, but everyone was left to their own device.
Yeah.
The catastrophic result of this massive oversight is that it is now the largest single source of deaths in this country. And in terms of coronavirus sufferers, 12% have now come from that one cruise ship. Ironically, on the day Gary and Kerry boarded the Ruby Princess, the passengers disembarking from the same ship on the same day were tested if they were feeling sick.
Why would the previous passenger load be tested and none of you tested? Doesn't add up.
Yeah, that's shocking to us. We didn't know they had been tested when they got off, and we were all expecting to be tested when we got off because just to be sure, to be safe. You're letting us out in the public around people and nobody tested us, and I really think that was disgraceful.
Kerry and Gary knew 10 other people on board the Ruby Princess. 8 of them in total contracted COVID-19. 2 ended up in hospital.
I still don't think we've got to the bottom of it.
No, we are extremely, extremely mad, sad and cranky that we weren't told that somebody potentially had it on the ship. That has infuriated us because if only everybody had known, everybody would have stayed put. Like, if we had to stay on the ship, we would have stayed there. We're just extremely mad that we weren't told anything.
All travellers entering Australia must self-isolate for 14 days.
Carnival's Princess Cruises say they've done nothing wrong. During the cruise, the ship's doctor took swabs of 15 sick passengers, but was unable to test for COVID-19. Complicating matters, there was flu on board, with 104 people taken ill suffering respiratory infections, a major symptom of coronavirus. Senior Vice President of the company, Stuart Allison, released a video statement this week.
They required guests who had reported flu-like symptoms to self-isolate in their cabins. The ship then reported these cases to federal and state authorities, as we're always obliged to do.
It's clear no other passengers were told about the flu, nor the ship's concerns about coronavirus.
But these leaked emails prove the Ruby Princess did alert New South Wales Health about the sick passengers. Incredibly though, the afternoon before the ship arrived back in Sydney, the department gave the vessel a clean bill of health. They even claimed there was no risk setting for COVID-19 being on board. Now, that's an impossible thing to say because they still had to wait for the 15 swab results. And when those results came through the following day, New South Wales Health's gross mistake was exposed. 3 people tested positive to coronavirus. Does that make you angry?
Oh, it makes us furious.
Well, it's negligence, isn't it?
So somebody knew something, and a lot of other people, including yourselves, weren't being told.
That's exactly. Right. The last day when we're getting off in the muster areas,
there's heaps.
Heaps of people had them, and they were surgical masks. And I said to Kerry, I wonder if these people are all been sick. And obviously, that's what's happened.
Well, I guess the cruise industry has sailed into the perfect storm.
As an infectious diseases specialist, Dr. Clay Gollidge is not surprised that coronavirus has thrived on cruise ships. He deems these tourist megaships as the perfect breeding ground for all viruses.
So you've got a steel and aluminium structure full of hundreds, thousands of people in relatively confined conditions. A lot of those passengers are elderly. A lot of them have heart disease, lung disease, diabetes, peripheral vascular disease, smoking, etc. You've then got the crew. The crew quarters can be pretty awful. 4 or 5 people in a room, no windows, shared bathrooms. So everything's kind of ripe for cross-infection.
What you're describing to me is the sort of perfect floating laboratory to breed these things.
Correct. It's an incubator. So it's a bacterial and viral incubator for coronavirus, and you couldn't have scripted it worse. And the longer you keep people on these ships, the more cases you're going to get.
What is also shocking to Dr. Gollidge is the lack of care cruise ships have shown, selfishly choosing to continue to sail when the world was counting down fast to a pandemic. He's adamant governments were too slow to act at the beginning and didn't focus on turning away the most infected monolithic structures of all.
And that should have been probably mid-February that the cruise industry needs to shut down. Go back to your ports, discharge your passengers, repatriate your crew, shut it all down. Yet here we were in mid-March, still people booking cruises and going off and sailing off around the world. So I'm gobsmacked by that.
But people still booked and still got on the ship.
Still booked, still got on the ship. So now we're in this storm of uncertainty. We've got ships off the East Coast. We've got a ship still stuck in Fremantle at the moment. Who knows, what's going to happen?
That ship in Fremantle is a German cruiser called the Artania. It won a battle for help just over a week ago, when the WA government was forced to open up Perth hospitals for 41 sick passengers and crew. That number keeps rising, and that's why Dr. Golich warns this is a dangerous game.
We run the total risk. If we take all these passengers from all the ships around Australia that are ill, our health system could well collapse.
Just on the strength of what's floating off our oceans at the moment?
Totally. We don't have infinite resources. We're scrambling like mad to create more beds, so our whole system could be totally overwhelmed, yes.
This has to be one of the #1 issues in the country to solve.
On the West Coast, WA Premier Mark McGowan had a tough battle against 5 cruise ships refusing to leave Australian waters. Just this week, 4 finally departed, but that German cruiser, the Artania, still staunchly remains.
It caused me sleepless nights, it's caused me nightmares. It's one of those things that is sitting there as a potential time bomb. So it's one of the most difficult things I've had to deal with in my time as Premier.
He feels his state has done its fair share of helping out cruise ships, flying home 850 passengers and caring for 41 sick patients. But for WA, enough is enough.
You were a lawyer, Premier, with the Australian Navy. What does maritime law say about this?
Well, it says you've got to look after people on the high seas, but at the same time it says that you can remove a ship from your port. So it's contradictory. I think what the Australian public wants to see is a tough approach to ensure we protect our hospital beds for Australians who need them, and we get people back to their homes as soon as possible in other countries.
Clearly those cruise ships are hanging around because they want to be within a stone's throw of a decent medical system.
Well, that's probably the answer, but that's clearly not acceptable.
So far, our federal government has ordered all cruise ships leave Australian waters by mid-June. After that, the operators face 5 years jail and a $63,000 fine. While 5 ships left Sydney Harbour late yesterday, there's still more than a dozen dotted around the country's coastline, including the Ruby Princess in Sydney and the Artania in Perth. Both have COVID-19 on board.
So it's a question of almost sacrificing some of your local beds for foreign tourists. That won't go down well with the population either.
No, and that's why, the ship needs to be gotten away as soon as possible, or all those ships. That's why I'm saying there's a lot of priorities in Australia at the moment, but this really needs to be elevated to #1.
Coming up, our special coverage of the coronavirus crisis continues.
Gary Callahan's coronavirus has terrified his wife, Kerry. She takes all the precautions she can while her husband battles the sickness. For this story, our crew kept their distance, filming from outside through the couple's lounge room window.
It's unbelievably lucky, I've got to say, that Kerry, you haven't picked it up. You didn't get it. I mean, you got to buy yourself a lottery ticket.
I know. I'm thankful, but I feel guilty that I don't have it as well. I feel, why me? But I just thank my lucky stars, and every day I am scared of getting it as well. As long as he's got it, I am scared I'll get it as well.
Gary and Kerry were passengers on the Ruby Princess cruise that's become a coronavirus hotspot. 10 deaths now, over a quarter of all victims in Australia, and more than 600 others infected, all from that one ship. After what they've been through, this couple is desperate to get one message out.
Everybody's still walking around outside. I think they're all thinking, it's not real, this is not real. I just want to tell those people out there that it is real and it is dangerous and it is killing people.
So that message about staying home, staying away from other people and social distancing, you're a huge advocate.
Yeah, definitely.
Well, it works. Kerry hasn't got it. We're in the same house.
I'm keeping my distance. I'm not touching him. You know, people have just got to, look, give it 2 weeks, 3 weeks, 4 weeks, whatever it takes, give it that. And, you know, if you're alive at the end of it, it's job well done.
Tasmanian Leonard Fisher, another tragic victim of the Ruby Princess, lost his fight with coronavirus on Monday night.
Let's go back to the beginning.
His son Greg is now left grieving for his 81-year-old father and wishing he'd stopped his dad from boarding.
I'd bring Dad 2 or 3 times a day, and when he was in hospital, but getting near the end, he was getting very short of breath, couldn't hold long conversations, and he did say that if he was aware that how bad this virus was, and if it was on the ship, he would never have got on the ship.
When your dad told you that he was going to take this cruise, what did you say to him? Did you advise him against it?
Yes, I did. Tried to talk him out of it, but he said, at my age, I'll probably never get a chance to do another trip like this again. And he also said that if there was anything wrong on the ship, they would have cancelled it.
So he was relying on the ship being responsible?
Yes.
Why were you concerned?
Just about the impact of what the coronavirus could potentially do. You'd take these companies for what they are. You'd think if it was possibly on the ship, or if there was any sign of it, you know, it would have been out there to the passengers.
But Greg now knows the passengers were never informed. Firstly, about flu on board, with 104 passengers told to self-isolate and wear masks, and secondly, that 15 passengers had been swabbed for COVID-19.
Did your father tell you about any obvious signs of sickness on the ship?
He said that he had a gentleman sitting beside him that was coughing, about his hand over his mouth, and he was quite concerned about that.
Did he mention anything about coronavirus being talked about on the ship in an official capacity?
At no stage were the passengers told that there was a possibility of coronavirus on that boat. They were unaware of any sickness that was on that boat. It was just so wrong. Things should have been handled a lot better.
The blame game continues. Who's at fault is now being investigated by New South Wales Police. But it's already clear that the Ruby Princess alerted New South Wales Health about the sickness on board prior to arriving into Sydney. Kerry and Gary Callahan now question why they ever decided to step foot on the Ruby Princess.
I did want to cancel the cruise, but then we would have lost our money, and it's a lot of money just to throw away. If there was a concern, I would imagine that the health department or Princess or somebody should have said, cancel everything now.
Yeah, foreign affair and trade.
And nothing was done. So we're under the impression, no, okay, it is safe because we're not going to an Asian or Europe country, we're going to New Zealand, so everything must be okay. And within a couple of days, obviously, it wasn't.
So because you were going to New Zealand, rather than perhaps an Asian destination, you figured that was fairly safe because you were staying within the region?
We did, yeah. Silly us. Now we feel stupid and we feel guilty that we did go.
Would you ever go on a cruise again?
No. I don't ever want to go away again.
Coming up, more of our special coverage.
Without doubt, the doctors, nurses and other healthcare workers on the front line of the coronavirus war are heroes, but they're not invincible. And many have real concerns about their own health. They don't want to catch COVID-19. Tragically, around the world, the rates of infection and death among medicos are staggering, and mostly it's because they don't have adequate protective equipment. In Australia, hospital staff are reporting shortages of basic safety gear like masks, goggles and robes. And some are also claiming that with the pandemic on our doorstep, we foolishly allowed huge quantities of this equipment to be sent to China. As Liz Hayes reports, protect us is their cry.
In Italy, 7,000 doctors and nurses have been infected with the coronavirus and over 70 are dead. In Spain, 20% of the healthcare workers have the virus. In America, the toll amongst frontline medical teams is already frightening. Now, it's starting to happen here.
At Box Hill Hospital, 6 healthcare workers contracted the virus. Eastern Health still working to notify anyone who came into contact with them.
It's akin to getting soldiers and just bringing them out of the trenches without any armour, without any weapons, and just basically facing the onslaught that comes on. And this is an invisible monster.
In a major Australian hospital, this corridor leads to a ward where at least 20 COVID-19 patients are being treated. Every hand sanitizer dispenser is empty. And in this highly contagious environment, a cleaner can be seen not wearing head protection or an appropriate mask.
Right now, our healthcare staff are being infected, and in a week's time or so, they will be in intensive care themselves. And this is already
Sydney anaesthetist Dr. Rob Hackett says one hospital has told him he could lose his job for speaking out. But he's voicing fears shared by many of his colleagues working in intensive care units across the country.
We're very scared. We can see what is happening across the world. We can see how we've been disempowered. We don't really have a voice. We want to be safe. We want to be safe when we're looking after people.
This is the sort of personal protection equipment worn by health workers overseas that doctors should be using here.
Their thick, waterproof suits means the doctors and nurses are sealed in.
But some Australian doctors are being forced to improvise, buying goggles, masks and shields from hardware stores. And in Dr. Hackett's case, ordering hooded gowns online because hospitals have simply run out.
Many of my colleagues who have purchased hooded gowns and other bits of equipment from Bunnings and have even pleaded for other people to go to Bunnings and buy these bits of equipment for them. And we are desperate. You know, we're at risk now ourselves. None of us have ever signed up for this.
Several highly trained intensive care doctors have told us that they're simply terrified. And many say they are often faced with little choice to deal with suspected coronavirus patients without protective gear or face the sack. When Dr. Hackett brought his own protective gear to work, his hospital said he couldn't wear it.
The equipment we do have is pretty much nothing much more than a plastic flimsy gown at times. And we're having to reuse masks, and a lot of staff members don't have masks. And we're desperate to get these things onto the front line as soon as possible. This may not be the message that's coming from, you know, the managers and the governing bodies of healthcare, but this is certainly the message from frontline staff.
China manufactures the majority of personal protection equipment for health workers around the world. But when it realised this unrelenting virus was not going to be beaten, it took an extraordinary step. When this pandemic hit China, what happened to those factories you had there?
So we have 3 factories in China. and the factories in Shanghai were requisitioned. The production was requisitioned by the government of China.
When you say requisition, that means taken control of?
Yeah, so the government sent people to take control of the inventory and the production in our factory.
The Chinese government commandeered Guillaume Laverdeux's company, Medicon, that produces millions of face masks and gowns, and stopped him selling any overseas. Do you feel comfortable as the owner that you lost control, ultimately, of your own factories?
Not a comfortable situation to be in, but I'm not sure we have a lot of choices.
Shockingly, despite being in control of the bulk of the world's supplies, it wasn't enough. So China put a call out for more, and Australia responded.
I think the main concern was if all of these essential medical items leave the country, what's left for us?
In Sydney, staff at Chinese-backed company Poly Developments and Holdings were urgently mobilised by email to find masks anywhere they could.
If you have time, please drop by your local pharmacy to check if there are any 3MN95 or 8210 masks for sale.
Staff bought up what they could from pharmacies in Eastwood to Penrith, Hornsby to Mona Vale.
Meeting rooms, lunch rooms, and the boardroom starting to be filled with different types of items, getting unpackaged and repackaged and labelled, definitely rose my suspicion.
This man worked at Greenland, a Chinese-owned property development company in Sydney. He saw tons of gloves, masks, gowns, sanitizer and other vital medical supplies being brought in, then shipped out of Australia.
The way this activity was organised, from going to procure different medical items, from the urgency to collect it, from the way it was unpackaged and repackaged, from the way full-time employees were utilised.
What our witness saw was being repeated in offices in companies around the world. Over the course of 2 months, China amassed an estimated 2.4 billion pieces of protective equipment, including more than 2 billion masks. By late January, with the coronavirus now a global threat, Australian doctors warned that our stocks of face masks were already dangerously low because of the bushfires. Federal Health Minister Greg Hunt didn't seem worried.
So there is a national medical stockpile of 12 million, in addition to those that were provided for bushfires, where there are still significant reserves with the states and territories.
But on February the 7th, the minister would learn that the World Health Organization was also concerned.
The world is facing severe disruption in the market for personal protective equipment. Global stocks of masks and respirators are now insufficient to meet the needs of WHO and our partners.
Despite that warning, and in full view of the media, on February the 24th, another Sydney-based Chinese company, Risland, sent 90 tonnes of medical protection equipment to China. It's a dilemma, isn't it? There are people in need somewhere else, but we find ourselves now desperately needing those same items.
But if you're operating in Australia, who are you listening to? Are you listening to the government of your own, of the country you operate in, or are you listening to your parent company in some other part of the world, and are you doing whatever they tell you to do?
Australia is now preparing for the worst of this pandemic, but frontline health workers are still desperate for personal protection equipment. Just last week, the Australian government finally banned the non-commercial export of PPE such as face masks, hand sanitizer, gloves and gowns. Well, now the government has banned the export of these items. What's your reaction to that?
I think it's good, but I feel like the horse has bolted. We could have been more proactive. We could have had some sort of contingency plans, in place, for situations like this.
No regrets for speaking up?
I think in a time of crisis, we all have a responsibility to do something. And I felt that I had to do something. It just didn't sit with me that this type of thing could happen. I couldn't just watch it and just stay silent.
Coming up, more of our special coverage of the coronavirus crisis.
Welcome back to our special live edition of 60 Minutes. I'm joined now by the Federal Minister for Health, Greg Hunt, from his office in Somerville on Victoria's Mornington Peninsula. Thank you so much for your time, Minister Hunt. More positive signs today
pleasure.
that the curve is flattening.
Yes.
How do you keep people at home in the face of some positive news?
Look, it's very important. What we're seeing is we're moving from over 25 to 30% of infection growth on a daily basis, down to the low teens just over a week ago, just below 10%. And now, as a country, through the work on the borders, testing, the best regime in the world, contact tracing, and all of the hard work that Australians are doing magnificently on self-isolation, we're now down at about 5% a day growth in infections. Much more to go. That's the message, much more to go. But half of our job is to reduce infections and flatten the curve, and the other half is to boost capacity. Telehealth for our GPs and our primary care to protect our patients and our magnificent health workers, our work in aged care, and then our work in the hospitals, where we've brought 57,000 nurses and 30,000 beds into the system through the partnership with the private hospitals. These are the things. Bringing the curve down, which we're now beginning to see really happening, and that's only due to the work of Australians, and boosting the capacity of the system at the same time.
There's been great concern, as we've seen here tonight on our program, from the frontline medical workers that just to do their jobs, that they are putting their lives on the line. To save lives, they're possibly at great risk of losing their own. Can you guarantee that they'll be given the protection they need to do their job?
I do have very good news on this front. These are genuine heroes, and whether it's our nurses, our doctors, our pharmacists, our aged care workers, we've already distributed 11 million masks, but we've just received over the recent weeks 30 million masks, and I can release that via you this evening. And that's replenished the stockpile. It's still a global challenge, but we will immediately move to make the first 10 million of those available to precisely the heroic health workers you're talking about over the coming days. More to come, including significant amounts of gowns, gloves, goggles, and so we're working in a difficult global environment as well as making masks here in Australia. We expect over the coming months to the end of the year to make up to 200 million masks. So this is about protecting our population, but above all else, protecting our magnificent health workers.
Yeah, is it a quality that affords the best protection for these health workers? And
yes, it is.
And will the stockpile remain, or will we run out again?
So one of my most important jobs is to make sure that we are working on the supply lines, both from overseas and within Australia. That, for example, the Army has moved in to help a small central Victorian firm with the support of the Victorian government, the Australian government, to make masks, to do this to a quality which the CSIRO has certified as being surgical grade. These are critical steps to protect our health workers, because what we don't want to see here is what we've seen happen in some overseas countries, and our health workers are the front line. This news, along with the fact that over the weekend the Finance Minister, Matthias Cormann, has made an additional $800 million available for PPE or personal protective equipment, where our focus is firstly our health workers, but that protects them, and with telehealth, which provides distance and space for patients, it protects our patients. All of these things are coming together to boost the capacity at the same time as we help contain the virus and reduce the spread.
How angry are you, Minister, over the debacle of the Ruby Princess cruise ship? Because it really has been a debacle, hasn't it?
First and foremost, it's been a human tragedy. And we know that New South Wales has today called both a criminal and a coronial investigation, and I think that was the right thing for them to do. Whilst the ship was in their care, they are nevertheless doing their best, and they've raised some very significant questions about the communications from the company in question. I'll let them proceed with that, but I do want to say to all of our health workers, to all of the people around the country, our focus is always in terms of the testing, the tracing, following up these cases and protecting the patients. We are now at just over 5,600 cases. Very importantly, 33 cases in ICU under ventilators, and that's been stable for a number of days. So all of these things are incredibly important, and that's a number that I follow because these are the most critical cases, and it all comes back to the fact that if we can test and trace, it doesn't matter where the source of an infection is, we're ultimately going to give ourselves the best shot of saving lives along with the social isolation.
All right, Minister, thank you very much for your time. We appreciate it. We understand how busy you are. Thank you very much for tonight's update.
Thanks very much, Tara. And I do want to say this to the Australian people. Thank you for what you've done. You are the ones that have helped reduce this rate of infection, and it will be a difficult few months. But as my 85-year-old uncle who lived through the war as a young boy said to my daughter today, there'll be better times and we will get through this.
Well, I hope so. We all hope so. Thank you for your time.
Cheers.
More of our special coverage of the coronavirus crisis in a moment.
By upending humanity so quickly and completely, coronavirus itself has become a world superpower. And until there's a vaccine or cure, even the mighty United States is incapable of stopping its rapid advance. More than a quarter of global infections are now in America, and like elsewhere, so many have already died. But there's worse to come. It's estimated the peak in the number of deaths won't occur for weeks. Liz Hayes explains why the US has been brought to its knees.
America is used to winning wars. But this fight, especially for its president, is different.
I've seen things that I've never seen before. I mean, I've seen them, but I've seen them on television in faraway lands. I've never seen them in our country.
It's been a sharp learning curve for Donald Trump. 2 months after the first case of coronavirus landing in the US, the president is now faced with an infection rate higher than anywhere in the world, and a hospital system crippled by the sheer number of patients.
Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all.
We're looking at very large numbers of deaths in the United States over the next 6 to 8 weeks.
Professor Ian Lipkin, known as the virus hunter, is one of the world's leading infectious disease epidemiologists. He fears this virus will cut short many lives. It's been predicted that the loss of life in America could be up to and over 200,000. Do you think that figure is reasonable?
I would like to think that we could hold it down to a number between 1 and 200,000, which is already a tragedy. But the idea that we might lose as many as 2 million people is just, it's just inconceivable.
It is an unthinkable figure, but this virus is frighteningly infectious. Even Professor Lipkin, who understands more than most how to avoid it, is another of its victims. What are your symptoms?
Well, at this point, all I have is a residual cough. When I first became ill, I started with a cough, and then I developed a headache. It actually woke me from sleep, and fever and night sweats and a few other things of that nature. It was very unpleasant. I'm now approaching day 14, and I'm feeling much, much better.
67-year-old Professor Lipkin is one of the lucky ones. 48-year-old Caius Kelly was not.
The text said, I'm sick, I'm in the ICU, but okay, and I can't talk. I responded and said, do you have the COVID virus? He said, yes.
We love you, I love you, and I thank you with all my heart. Bye.
Caius Kelly was an assistant nursing manager at Mount Sinai West Hospital in New York, where some staff resorted to wearing garbage bags as gowns. Caius's sister, Mariah Sharon, first learned of her brother's illness on March 18th, when he texted her.
I said, are you on a ventilator? He said, yes, and asked that I not tell our mom and dad. He did not want them to worry. And then it said, I love you, and it was an emoji with him and a big heart on his back, and he said, I'm gonna go to sleep now. And that was it.
Caius died alone 6 days later. He is believed to be the first nurse claimed by the virus in America.
It's upsetting the way we have ill-prepared for our front line and left them to fend for themselves. They just didn't have what they needed. They just did not.
And when you look back on that, is this what you expected of America?
No. It is devastating, and the idea that they're in Australia or any other country in the world would follow our lead in the way this has been handled makes me ill. There is nothing about the way that we have handled this that has been good, given the time that we had to prepare.
Look at this. Just completely empty.
Is it slightly unsettling to be living in the United States at this time?
Yes, it is.
Are you at all worried about your own health and the health of your family?
Well, of course. The United States has a really fractured health system, and Americans have a very strong view about freedom and liberty. When you shut down an economy, the threat is civil unrest. I think the increase in gun sales and the increased military presence and National Guard presence on the streets indicates that leaders share that view.
Few Australians have as close an insight into the mind of President Trump as Joe Hockey, Australia's former ambassador to the United States. During his 4 years in Washington, D.C., he enjoyed rare access to the president and his closest aides.
Unquestionably, the president was slow out of the gates. Donald Trump is not someone that readily relies on expert advice. Throughout his life, he's operated on gut instinct, and that's been very successful for him. But on this occasion, you have to take the expert opinion. Whenever I've met with him, it's clear that he is very careful about his personal hygiene. He takes a view that his behaviour is what everyone should do, and therefore they won't get the virus. Well, that's changed.
Hockey is now permanently based in the US, and he records his morning walks through the empty streets of Washington.
Why am I documenting this? Well, because I want my kids to remember how significant this event has been, not just for the United States and Australia, but for the whole world. There's just no one around.
Are you tempted to come home?
I've started up a business here, and I've got to make it work. And you know, after 24 years of public life where it's an endless sea of events and meeting people, I feel like a monk that's gone into a monastery. And it feels pretty good that we can take the moment to reflect, that, hopefully it makes us better people.
You doing some home cooking?
Yes. I'm a shocking cook. I'm not bad as I can eat, but I can't cook. And, I'm doing everything, washing, cleaning the bathrooms, washing the dogs, the whole thing. My signature dish is rice and canned tuna.
The virus is changing how we all live and interact. As Joe Hockey watches his former colleagues grapple with the crisis in Australia, he says there is an important lesson for our country.
The world that we're going to inherit from the end of this year on is going to be very different to what we've lived in. I think you're going to see the world divide into 2 or 3 camps. You're going to see America look inward about all of its supply lines, massively reduce its reliance on China, India and the rest of the world for a lot of its supply lines. What we want in Australia is to be there as a close ally and make sure that we're part of the American narrative and they don't leave us behind as they take on a very new direction.
America's iconic landmarks are now eerily empty. New York is the epicentre of its battle with the virus, but other cities will follow. Right now, this great Western superpower is seemingly impotent to an opponent that may take much longer than many think to defeat.
As long as this thing exists in the world, we are all at risk. And it will ping-pong back and forth with every season. And it may take 2 years. And God help us. I don't know what else we can do.
Coronavirus's trail of death in the United States is a powerful reminder of why the virtual lockdown we're all under in Australia is so important. Hello, I'm Tara Brown. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.